The Healthcare Labyrinth Podcast is back for another episode. Join Marc S. Ryan, a veteran health plan and health technology executive, as he explores the world of healthcare.
Welcome, everyone, to this edition of the Healthcare Labyrinth Podcast. My name is Marc Ryan. It's a pleasure to be hosting the podcast, and thanks to everyone for listening in. This week, I think we're going to have a fairly short podcast, but what I wanted to do here was just go into one other controversy now arising within Medicare Advantage. In previous blogs and podcasts, we talked about the problem of Medicare Advantage overpayments, a belief that the risk adjustment system is being abused, and things like that. As you know, on that issue, I am a little bit in the middle. I do not believe everything that opponents call overpayments are truly overpayments. I think there are problems in the fee-for-service system where disease states are not recognized, and therefore what some of the opponents are saying about overpayments are just not true. But in an earlier blog and podcast, I did talk about the fact that I'm somewhere in the middle on that issue. I believe there are some bad actors that are inappropriately coding, and they represent the majority of these so-called overpayments that opponents are talking about. I also, in an earlier blog and podcast, said that I think it's probably about time to phase out the exclusive use for diagnoses of health risk assessments as well as manual chart reviews. They could supplement things, but they should not be the only source for diagnosis and risk adjustment. Recently, on another podcast, I talked about another major issue going on in the regulatory world for Medicare Advantage plans, which is supplemental benefits. These are the benefits that are added by MA plans above and beyond regular Medicare benefits. They are very costly because they come out of the rebate dollars that we talk about often that MA gives plans. And so these rebate dollars are supposedly supporting supplemental benefits. But frankly, everyone, including me, believes that there's fairly low utilization of these benefits, and yet they are put into bids at very, very high bids and utilization rates in the annual benefit and bid process. So low utilization, fairly high utilization assumed in the bids, and high costs against the rebates. And there's absolutely little to no encounter data being submitted on these supplemental benefits. I told you also that CMS is now requiring the submission of encounter data for supplemental benefits. And as of 1/1/25, plans will have to market these in a better way and not mislead members, as well as issue mid-year utilization reports to each member telling them what supplemental benefits they have used and what ones are still open. So those were sort of the two big areas of controversy in MA that I talked about in earlier podcasts, the overpayments and the supplemental benefits. I'm going to get into another one here too. And while I feel some sympathy for health plans, both on the overpayments and supplemental benefits, I have sort of the same view here on this issue I'm going to tell you about. So this is about the broker agent compensation in the Medicare Advantage program. As many of you know, a broker is sort of a key part of this enrollment process, and an agent is a key part of this process as well. MA plans may hire some of their own sales agents that work as employees or as captive agents. They're independent contractors, but they pretty much work exclusively for a given plan. But most of the enrollments are coming from independent agents who roll up to brokers, or what are also known as third-party marketing organizations. And these third-party marketing organizations are very large broker outfits, have been criticized by CMS of late. the number of complaints against these third-party marketing organizations for misleading advertising, inappropriate enrollment, and things like that have been rising. And CMS has begun to try and get their arms around this. Initially, what CMS did was sort of rein in a bit the types of ads and some of the allowances for marketing agencies. And they also began to, in the program audits, really hit plans much harder on their oversight of these organizations. However, not a whole lot had changed, frankly. It's very hard for plans to have oversight of these third-party marketing organizations. And in truth, some of the types of compensation that they would enter into with these TPMOs were driving enrollment to their plans. So they didn't have a lot of incentive to do this. So in a general sense, in the regulatory environment, agents are paid a fee that is for a new enrollee that is higher than one for a returning enrollee. But in generally speaking, those agents receive fixed compensation. But what plans were doing was entering into side agreements, side contracts with these third-party marketing organizations or large brokerages where they were giving extraordinary compensation that actually wasn't terribly well regulated. And these third-party marketing organizations, depending on the lucrativeness of a given plan's agreement, would then essentially steer members into their plans. And CMS was, again, very worried because many members were sending in complaints to both health plans at the grievance level, but also to CMS through the complaints tracking module. And these members or these enrollees were saying, I was misled about the enrollment. I was enrolled in a plan that was not appropriate for me. And CMS, tracking these things back, was finding that plans, again, had very little oversight of these TPMOs. Number two, sympathies for plan here. These TPMOs are big mega organizations and don't always follow great oversight principles in and of itself. And third, again, there was variable compensation that allowed these third-party marketing organizations essentially to steer individuals to given plans, whether the benefit structure or the ultimate costs were going to be good enough for that member. So after some of the initial reforms and rules, as well as program audit oversight, CMS said they really had to do more. And when we get back from our first break, I'll tell you what the more was for CMS and what interestingly happened in a federal district court. We'll be right back.
The Healthcare Labyrinth is no ordinary website. It features news and commentary from one of the nation's leading healthcare policy and technology experts. Marc Ryan combs the internet for the latest healthcare news and publishes a news feed each weekday with summations and Marc's insights. Twice a week, Marc publishes a blog to go deep into a current issue. And of course, Marc hosts a podcast each week to delve even further. All of this is available at healthcarelabyrinth.com. Visit each day for the latest happenings in healthcare. As well, learn more about Marc's book, The Healthcare Labyrinth, at the website. That's healthcarelabyrinth.com, your go-to source for healthcare news.
Welcome back from the break, and thanks for listening to this edition of the Healthcare Labyrinth Podcast. We're talking about agent and broker compensation within Medicare Advantage and some of the extraordinary financial deals that essentially led to steerage of members by these broker organizations or third-party marketing organizations into given plans based on these agreements. Now, some might ask, how do we know these agreements exist and they had the effect of steerage not in the best interest of members? Well, Number one, we did have the complaints, and so CMS investigated those complaints and found this, and they found sort of just a litany of people claiming they were not in the right kind of plan for them. But more importantly, there were some whistleblower agents that worked for these brokers and these TPMOs, and these workers complained that as a condition of their job, they were being ordered to coax members into certain plans, even if it meant higher cost or fewer benefits for these members and their families. So again, these whistleblowers sort of underlined the big problem that was occurring here. So as I told you earlier, CMS tried to tackle some of this a few years back. They basically, after these major complaints about the actions of these TPMOs and a lack of adequate MA oversight, CMS proposed and finalized some more rigorous oversight for MA plans, as well as restrictions on certain television advertisements. And further, CMS really looked at TPMO and broker oversight in program audits when they were being scheduled with plans. But clearly it didn't work, and CMS had to do more. So effective January 1, 2025, CMS finalized a rule that sought to stop the steerage deals with MA plans based on the extraordinary financial incentives. While overall compensation per enrollee still went up to help support the broker and TPMO structures, the extraordinary variable incentive deals between MA plans and brokers and TPMOs were barred under that rule. Let's talk a little bit about some of the specifics of the rule. Well, the rule redefines compensation to set a clear fixed amount that agents and brokers can be paid regardless of the plan the beneficiary enrolls in. And this compensation, this fixed comp went up by about $100 for new enrollees from 611 to 711, and a smaller overall amount for renewals. So essentially for new enrollees, total fixed compensation between the agent and the brokers or the third-party marketing organization would be a total of $711 moving forward. But this rule also eliminated variability in payments and bonus compensation, especially with brokers and TPMOs. The new rule had the effect of substantially reducing overall comp in the system. Some indications were that it could have amounted to about a halving of existing compensation, but most of the excess compensation was clearly retained by TPMOs and a subset of agents and brokers anyway. One plan lobby, the Alliance of Community Health Plans, recognized the importance of really returning integrity to the system. They actually proposed the reform that CMS put in place and backed it throughout the process. So congratulations to the Alliance of Community Health Plans for having such a forthright and moral stance on this issue. Now, here's the problem, of course. As good as the Alliance of Community Health Plans and I thought this broker and agent compensation reform was, a federal court has now stayed the implementation of the changes nationwide. And when we get back from our next break, we'll get into what the judge decided and where we are today.
Lilac Software is proud to work with the Healthcare Labyrinth website to educate people on the healthcare system. At Lilac, we believe transparency is so important in healthcare. The healthcare system is opaque, and Lilac is trying to bring clarity to data and unleash the best member care, reduce costs, and improve outcomes. Our cloud-native payer platform revolutionizes data insights and analytics. Plans have all the data they need, but in silos locked away in point solutions. At Lilac, we solve the data fragmentation problem and help plans turn complex data into actionable insights, leading to greater operating leverage, tight cost controls, and healthier members. Health plans can improve STAR scores, reduce medical expense, drive revenue, and more. Quite simply, with Lilac, you can drive better business and health outcomes. Learn more at lilacsoftware.com.
Welcome back from our second break, and we're talking about agent and broker compensation in the Medicare Advantage world. Well, I told you right before the break that a federal judge stayed implementation of the reform to agent and broker compensation that CMS put into a rule. The judge found primarily in favor of Americans for Beneficiary Choice, an association representing insurance brokers, as well as two insurance agencies that were also plaintiffs. The judge said plaintiffs met several bars required for a stay, which includes a fairly high substantial one, which means that they had to demonstrate that their businesses would likely suffer irreparable harm if the rule was not stayed, as well as they had the likelihood of success on the merits. So the judge found that they did have irreparable harm if it went into effect, and that, in fact, he believed that there was a likelihood of success on the merits. So that met the standard for the judge to stay the rule. The judge also called the finalized CMS rule arbitrary and capricious because the agency did not substantiate how the increased compensation of $100 per enrollee from the current steady state made up for the other broker and TPMO compensation. The judge also found that the rule went beyond the agency's purview. As a side note, the decision really has nothing to do with the Supreme Court striking down of the Chevron deference in administrative rulemaking. Indeed, the judge's finding that the rule is arbitrary and capricious would meet the standard to strike a rule under the old Chevron deference precedent anyway. Nonetheless, the decision would seem to underscore what agencies are in for, as lower courts now do not have to defer to agencies on many aspects of interpreting the laws. So I did a Chevron deference podcast and blog if you want to go to the website to listen a bit to that. So where we are now is we are a bit in limbo. The judge stayed the agent and broker compensation reform in MA. CMS quickly came out with a memo that basically said, okay, the law is stayed. We still may appeal this, but the old rules essentially stay in effect. So the $611 new enrollee and roughly half that for a returning enrollee for an agent would continue. And theoretically, these TPMO agreements between plans and those marketing agencies and brokers can essentially be reestablished, and we go back to the old way of doing things, which in my view is not very good. We're going to continue to have complaints, and I just think it's a very, very bad thing for members enrolling in MA. So winners and losers here. This is a victory for both the major TPMOs and major health plans. They like this arrangement. They feel like they can get members steered into their plans, and they're willing to pay for it. And the TPMOs clearly make out because they get the benefit of that variable incentive-based compensation. And really, in my view, the major health plans colluded with the major marketing organizations to push membership to them as MA blossomed, and that's very unfortunate. When MA plans were ordered to ramp up oversight, many did so half-heartedly under the old reforms as they benefited from the cozy deals with the big brokers and TPMOs. Ironically, they now face a big dilemma on their victory about how to ensure a smooth 2025 enrollment season with compensation agreements in question. But there's no question that plans are busy reframing those third-party marketing organizations, dusting them off, re-implementing the old rules. So some would say that the enrollment season could be rocky due to low star revenue, negative rate hikes, and a return of utilization and inflation, and that this ruling compounds it. But I don't see it. I think those old agreements were already being re-upped as the case was proceeding, and that will not have major impact on the enrollment season. The losers here are clearly some smaller health plans without the resources of the big plans to have those steerage agreements, as well as two other parties, the smaller broker agencies and the independent agencies that act with integrity. And oh, by the way, the members, because the members are still going to be steered into wrong plans, in my view. So with that, we will take our last break, and we will come back to just say, where are we going from here?
Health plans and insurance are confusing. Our healthcare system is in dire need of reform. Health policy expert Marc Ryan tackles both issues in his book, The Healthcare Labyrinth. It is both a guide to navigating health plans and fixing American health insurance. Marc dives deep into how health plans and the American health insurance system operate. He then outlines a comprehensive reform agenda for the system as a whole, including pricing, emphasizing health and care management, and ensuring affordable access to health coverage in a private delivery model. Marc is a bit of an unconventional Republican in that he believes affordable access is the morally right thing to do, and that it is also fiscally prudent for our nation. Learn more about Marc's book, The Healthcare Labyrinth, at healthcarelabyrinth.com or search at leading bookseller websites. Available in print, ebook, and audiobook forms.
Welcome back from our last break here, and we're just talking about agent and broker compensation. And now we're going to moving forward. We know that plans are busy re-upping the old agreements with brokers and TPMOs, these large-scale organizations that make out like bandits, while members and smaller health plans and smaller broker agencies and independent agencies sort of are losers in all of this. But what's happening moving forward? Well, I believe that the administration and Congress should come together in the best interest of members and find a way to get this regulation back in place. There's no question that CMS's proposed reforms were good for the nation and beneficiaries. MA is a popular and important program, but these types of abuses throughout the MA system give the program a very bad name and take away from the value of the private alternative to traditional fee-for-service. It is not unlike the bad actor health plans that abuse the risk adjustment system to gain revenue, or perhaps even abuse supplemental benefits to drive enrollment. The federal court stay and the lack of reform likely means continued steerage of members against their best interests and a return to major complaints on marketing and enrollment, as I mentioned. The judge seems convinced that the rule was arbitrary and capricious and may be far beyond what the agency can do. Implicit, certainly not stated, is the thought that the regulatory agency should not impact contracts between entities engaged in free commerce. But the fact is that the MA plans and brokers are engaged in enterprise using taxpayer dollars, and the agency and Congress should have the right to ensure integrity and fairness in that system. If it is likely that under the repeal of the Chevron precedent that such reforms are destined for constant litigation and stays, Congress should get together with CMS to clearly dictate the rules and the ability of CMS to implement them. If the judge is right that it goes beyond the agency's prerogative, Congress should clearly lay out why they believe that this is in the cognizance of the agency. And more importantly, because there's some question about exactly how this was spelled out, Congress should clearly indicate what the compensation should be. And more importantly, CMS should also do some studies to evaluate not necessarily giving all of the dollars that were in the system, but one that can substantiate some layers of bureaucracy over regular agents enrolling members into systems so that we have a reasonably running system, but one that does not steer members to the wrong plan. Whatever the status of this rule and what happens in Congress, I hope Congress does act with explicit authorization about what needs to be done to overcome what the judge has done. Some MA plans saw the writing on the wall and began initiatives to clean up their own acts, ever so slightly perhaps, and still playing the game that was in force. So I think more and more plans will abandon the unseemly deals in favor of more transparency with the public they serve. Humana is one MA plan that has begun relying more on in-house agents. CVS Health recently acquired Hella Health, a startup MA brokerage that is tech-enabled. While accusations could be made that CVS now will use Hella to steer members to them, it does change the paradigm for good in many ways. CVS wants to build a trusted agent model and have tech resources that transparently educate members on benefits in a direct-to-consumer method. I would also note that Humana actually just made a minority investment in Health Pilot, which offers consumer artificial intelligence-driven guidance on selecting MA plan options. So you can see here both CVS and Humana are moving toward having much more transparent processes for enrollment and backing away from these very large steerage deals out there. In the end, the controversy could lead to a positive realignment in the marketing area with new technologies to demystify enrollment and the myriad medical and drug benefits offered in the Medicare program. I am in the field an expert in Medicare and recently tried to help some seniors enroll in the right plan for them. Quite frankly, at times I was mystified in trying to determine the best plan for these friends, whether it was premium, cost sharing, covered drugs, or supplemental benefits. Sometimes I really could not make heads or tails out of what was being offered by these plans, and comparing all of them is extremely difficult. Yes, CMS has made great strides with Medicare.gov to allow people to compare, but it is by no means clear or concise. The elderly and those with health literacy issues have a huge battle, as did I. They get overwhelmed both in thinking about what to do and then searching for the right plan. And that is why they turn to brokers, and integrity must be a top priority. Additional tech investments are needed to clear up the confusion, make it easier for trusted agents and beneficiaries to understand what is best for a given person based on his or her individual circumstances. Ironically, many large-scale TPMOs had those resources and built intelligent systems. The issue was it based in part on the ugly financial deals that they put together. So they built into their technology those ugly financial deals. CVS Health and other plans may now build such technology for their approaches, and other entities may get in the game to serve independent agents, smaller broker organizations, and the public at large. Opportunities are there both on the complex retail drug front, where formularies, tiering, cost sharing, and the phases of Part D create challenges in understanding. Even with the coming $2,000 annual cap on the out-of-pocket costs in Part D, these decisions are important. On the medical benefit front, beneficiaries need to be educated on core benefits, including whether important gaps in the inpatient benefit in the traditional system are closed by MA plans. They need to also know about premiums, deductibles, and cost sharing, and other supplemental benefits that are offered. CMS is now requiring MA plans to do a better job on educating members on supplemental benefits, and they can be numerous. So that's a step in the right direction, but supplemental benefits, as large and far-reaching as they are today, could be part of this new technology to transparently tell members and beneficiaries what is the best plan for them. So educating members on the myriad benefits and advantages and disadvantages based on their unique clinical and social determinant circumstances is key. Technology and integrity can clearly do that. With that, we'll end this edition of the Healthcare Labyrinth Podcast, and we'll see you on the next Healthcare Labyrinth Podcast. Take care.
Thanks for joining Marc and the Healthcare Labyrinth Podcast. Go to healthcarelabyrinth.com each day for the latest healthcare news. See you next week on the next Healthcare Labyrinth Podcast.